MeTV 24 Meridian proudly presents your favorite way to start the day. Welcome to Mornings with Scotty Ray and Candace.
And good morning from Scotty Ray and Candace. And as you see, Candace is not in. We welcome our special guest, Miss Sidney Covington. How are you today?
I am good. Glad to be here.
It is. It's interesting to have you. You do so much in town. You just wound up with a play, am I right?
I just finished one. I have two more in production right now at the Little Theater. I'm not doing this by myself at home.
Really?
You know, it's at the Little Theater. I do beauty pageants at my house.
Oh,
yeah.
Well, what was the play that just ended up?
Dinner Theater.
Dinner Theater. Was it good?
Oh, yeah. I hate to say it, but yeah, it was murder mystery.
Murder mystery. What's the new one coming up? When is it?
Right now we've got teenagers that are about to do a production called Back to the 80s. And it's all the 80s music. Do you remember the 80s music?
Merle Haggard?
Okay. No, he's not in it, but he was in the 80s.
Earl Thomas Conley? I mean, come on.
Okay, y'all want to buy a ticket to this?
I'm going to just tell you, I didn't fit in with other kids that I walked to my own little beat there. I was a little different.
You went down the country lane.
I had flannel, and they had all this Izod stuff, and, well, I was different.
Did you tie-dye?
No, I didn't. I never owned anything tie-dye. Oh. It's like this morning, and let me pick up my phone so I can do this, because my wife, let me look at this picture here, which she told me was good, and so I went and checked it out. Okay. Anybody ever heard of somebody named Walker Hayes? Well, apparently they've made a song about Applebee's and going to eat, and it's rap. And in my professional opinion, that was the absolute worst thing I've ever heard in my life. And she seemed to think it was good. It was downright horrible. Have you heard it?
Yeah.
You like it?
Yeah. I mean, it's okay.
I cannot be the only man in America that thinks that is awful.
No, you probably aren't. But I thought it was kind of catchy because it was about Applebee's.
And I don't care what y'all say, Luke Bryan wears designer women breeches. That's what those are.
Who's Luke Bryan?
So you don't even know him either. You ain't missed nothing. I don't. But he's supposedly now a big country star, Luke Bryan.
Oh,
and Bryan. And he wears, they're women breeches. I'm telling y'all. Okay. Y'all get a good.
Mom jeans.
But you know how, when you would hear Vern Gosdin and it was just, boy, you lived it. You listen to Luke and you go, man, what he's really talking about? That's my opinion.
This is foreign language to me. I don't know any of these people.
I don't either. It's tough because I'll walk through a thing and I'll stare at the TV a second and go, so they call that country now.
Yeah, well, now you're right about that. Country's not what it used to be. They don't shoot a dog. They don't have a train wreck anymore. And now you have 3 women instead of just 1.
I know, and they all got to wear shorts, and you got to have a tailgate with liquor. That's a country song now.
You talking about the guys wear shorts or the women?
I think they all do because they don't know who they are anymore.
Daisy Dukes.
Things of that nature. Yeah. Good morning to you, Scotty Ray, and of course my special guest, Sidney, having her here. And our special guest, and we welcome him in, John. How in the world are you doing, John?
Good morning. I'm doing pretty good.
We're glad to have you here. And this is a serious issue. And let's do a close-up here so everybody can get a good look at you there.
Yeah, it's not the one with the hat.
That's a little scary.
A little scary there. Mm-hmm. What we want to talk to you about today is you hear so many rumors about COVID-19. All right, Meridian, Mississippi, and the surrounding areas. Meridian is the hospital center for all the area. Mm-hmm. What is really going on that people don't know? Is it truly a lot of people at the hospitals to where you can't get them all in that are sick? Are we having a lot of deaths? Start with this and tell us what you see.
Yes. It's been the surge that we've experienced over the past several weeks has been pretty dramatic. And one of the things that's happened this time around versus what occurred back in March, April, May, June of last year is the impact has been almost immediate. Back when the pandemic started and we started seeing patients at the hospital, we ramped up. It didn't happen immediately. It ramped up over time. To the point where we were realizing, maximum capacity in the hospital. This time was different. Literally 6 weeks ago, we were at a point, well, I'll give you an example. The 25th of March of this year was an anniversary of sorts for us. because it was a year from the day that we announced that we had received and confirmed our first COVID-19 patient, novel coronavirus patient at the hospital. So March 25th of 2020 was the day we announced that first patient. March 25th of 2021, we had 0 COVID patients in the hospital.
And that was good.
And it was great. Mm-hmm. And we went along that way for, we would have 1, 2, 3, maybe 4 patients in the hospital that were coronavirus patients. So we were back to doing what we had been doing in the past, which was taking care of the other type of patients. But we continued to do so. But within a matter of probably 3 to 4 weeks, as the variant started to show itself in the country and then started to migrate its way into the Southeast and into the state, we started seeing patient volumes increase, patients that were coming in COVID positive, and it went almost vertical to the point now that we're at maximum capacity, to the point now that the entire state is in that situation. And about 3 weeks ago now, Dr. Dobbs issued a statewide mandate that moved us back into what's called a statewide system of care. And in the statewide system of care, the state is divided into 3 different sections: north, central, and south. The central section is between highways 82 north of here and Highway 84 south of here. And it contains all of the hospitals, regardless of your ability to take care, your level of care that you provide. That's in the central section of the state. It includes all those hospitals. In the statewide system of care, you go into a transfer system. So Anderson, Rush, the hospitals in Jackson, hospitals in Vicksburg, et cetera, all the hospitals within the central part of the state. If a hospital receives a critical care patient that they cannot take care of, then they contact a central point in Jackson called MedCom. MedCom then transfers that patient to the next receiving hospital that can take care of that critically ill patient. You get in line, so you're in a queue. Mm-hmm. And that's the statewide system of care. And it's not just for the COVID patient population, it's also for the non-COVID critical care patient population. So we've been receiving patients over the course of the past 3 weeks from across the state. And they've been COVID and non-COVID populations. We have gone to a point of having to reach out to the Mississippi emergency management agencies and then also the federal agencies to request additional manpower assets to come into the hospital. We've done that along with others in other hospitals in the state to be able to stand up additional capacity because of the surge and what's happened. So our ICU has been full, our critical care units have been full, our emergency room has been full, our medical COVID unit has been full, and we're taking care of people who are not COVID and sick.
Let me ask this. So you're sitting at home and you feel like you don't feel yourself. Should you immediately go get a COVID test, or should you wait till you feel like you got more symptoms of it? When's the time to do that?
No, I would suggest that you go as soon as you can to get tested. And there are multiple opportunities out there to get tested. But you need to get tested as quickly as possible.
Now, do you suggest staying away from the emergency room where they can handle other things? Is there different places to go get this, or do you come to the emergency room?
No, your last resort should be the emergency room, because they're taking care of every sick person that walks into the building, plus whatever's coming in the ambulance side too. So I would suggest, and there are other opportunities. I mean, our Express Care Clinic that's on our campus tests patients. You typically call to get an appointment. EC HealthNet, the residency program on the frontage road, test patients. There are a lot of opportunities to get tested. COVID testing's done at the various pharmacies throughout the community as well. So there's a lot of opportunity to get tested, but I recommend that as soon as if you start feeling as if you've got signs and symptoms coming on, you need to get tested.
John, what about, do you recommend a lot of people are doing the home tests?
Yes. Home tests have been approved, and I will tell you that there's the home test is good to take, because typically in the home test, if it's a positive, it's probably a positive. All right. The problem you run into is you can have what's called a false negative reading. So if you take the home test and you feel bad and you get a negative, you probably need to follow that up with a facility that's doing testing that can just do a second test to confirm that home test.
Kind of a second opinion.
I'm sorry.
Kind of like a second opinion.
That's right. Kind of like a second opinion.
Yeah.
Right.
Now, what would you say in our area, and you may not know this from the top of your head, so I don't want to throw something on you because me and you didn't talk about this.
Sure.
On this leg of this COVID that we've got now, how many people have died in our area from it that have been brought to the hospital? How many people have passed away from it? Do you know?
I don't know the total. I know that we have seen a lot of fatality associated with this wave as a result, and it is truly within the unvaccinated population.
And that leads to the next question of Tate said at his press conference that of the deaths, it was 89% of people that were not vaccinated that were dying, and that the other were really, he said there are a few younger ones, but mostly it's the elderly in that 11% there that's left there. Is that kind of hold true here in Meridian also?
I would say so. I can tell you within the patient population, we're seeing 97% right now of those that are hospitalized are unvaccinated. There's I believe a 15-fold increase of hospitalization amongst the unvaccinated population. There's a 6-fold increase of death amongst the unvaccinated population. We have had several deaths from patients who were unvaccinated that range from 27 to 50.
All right, this comes to the next question. Sidney, I know you hear this. I watch this every day on Facebook. It's like a line drawn down through Central America of whether you believe in the vaccine or you don't. And people get it's heated. They get mad. What do you trust it? You're in the medical field. You're the CEO, the president of the hospital. What do you say to these people that can this save your life? And then that next question they always throw at you is, well, at first it's not FDA approved. Now it is. Well, I don't know what's going to happen to me in 3 to 4 years. What do you say to this person who thinks that? Is there anything?
Yeah, I find it kind of interesting, and we kind of talked a little bit about this before we started this morning. But first of all, I am an avid proponent of getting the vaccine. I've been vaccinated. I intend to get the booster. My family has been vaccinated, and I am truly a proponent of vaccine. I think that we have seen the results of the vaccine, that it works. It works among people who have taken the vaccine, have contracted the virus, but haven't been hospitalized. So I think it's incredibly important that you take the vaccine.
And that's been another right there. What you're saying is where they go, well, it's not going to stop you from getting it. And that's true.
That's true.
But it could save your life.
Absolutely. Absolutely. That's exactly right. Now, one of the things that's interesting to me, and I think this is because it's been so politicized, is we have for decades and decades trusted our physicians. And all of a sudden now we're not trusting them. There are probably people who are in situations with their health that have certain disease processes going on, or have experienced something that maybe that shouldn't take the vaccine, but you should consult your doctor. Mm-hmm. And unfortunately, that is not Dr. Facebook.
Yeah.
That is your physician in your community. And you got to understand, these guys are scientists as much as they are physicians. They are looking at data. They are looking at what's coming out from very respected journals and very respected research to make very informed decisions and provide that information to their patients. And right now, the most important thing that can happen is to get a vaccine.
Well, let me ask you something. I very seldom, if at all, have heard this addressed. people who have had the virus, have you seen them and are unvaccinated because they've had the virus? Have you seen those that you're saying that have come in and been affected by the COVID who've been unvaccinated? I mean, if they've already had the virus.
Right. Yeah, you're talking
Speak to the
about,
antibodies.
Yeah, there's a certain level of antibody resistance, and so antibody resistance is almost individual with the person.
Yeah.
There are folks that have had the virus that say they don't want to get the vaccine because they've had the virus and they have the antibodies. It is not recommended that you do that. It is recommended, regardless of whether you've had the disease or not, to get the vaccine, because the vaccine adds another layer of protection. It's like me wearing this mask. It adds one more layer of protection for you. So if you do contract the virus, then the effect of the virus on your body is not nearly as devastating as it is if you're unvaccinated.
But again, check with your own personal physician on that
Absolutely.
rather than
You should.
WebMD or something. Okay.
All right, we'll be right back with John here in just a moment. Talk some more about what's going on in the Meridian area with this that is just overwhelming. Let's talk about our friends up at Snowden and Company. And if you're looking for a home, this girl is a sweetheart. I've known her since she could walk, and she's really good at what she does. See Amanda and her team. They're located in North Hills. They're in Poplar Springs. Drop in. They've been expanding. If you're looking for a dream home, they can find it. If you're getting ready to sell your home, talk to her as well. It's high demand right now for homes. Make sure you get exactly what your home is worth. If you're selling it, they've got a great, extraordinary marketing strategy, comparable market analysis, so you know what your home is really worth. Now, they're going to take a lot of pictures and make sure it's the best that it can be to invite people to come take a look at it. As you go through this is a home that's up for sale right now. SnowdenRealEstate.com. Visit them or call them. It's 601-453-3937. Now, they take care of Lauderdale County, Kemper, Newton, Neshoba, Clark, and they've just added the Brandon, Flowood, Madison, and Forest area. So that's a big deal.
wonderful. Yeah.
It is. She's expanding, and, well, she's a hometown girl, really good at what she does. This is a home that sold not long ago. It had a beautiful lake out back. Makes you want to go visit and go fishing, doesn't it?
That's what I say. They should give out names.
See, there you go. These are some of the folks that sold their home with them. They take care of you. See Amanda. This is her. You can recognize her anywhere. She's a designated seller representative, certified real estate negotiating expert. Again, Poplar Springs. Call them today, 601-453-3937, and they'll help you any way they can.
I'm Richard Schwartz. If you've been in an auto accident, don't hesitate to call for legal help. Remember, the first 10 days following an accident are crucial. Insurance companies don't wait. They have a staff of adjusters, attorneys, and investigators collecting information that can be used against you. Again, remember, don't hesitate. Call me. One call, that's all. I am Richard Schwartz, and I'm here to help you.
Call Richard Schwartz today.
And welcome back, Scotty Ray, and of course Sidney filling in this morning, and our special guest that we welcome from Anderson's Hospital. As we said, this is right here the front lines of what's going on.
This is the horse's mouth.
It is, and he sees it.
And I mean that with all respect to you and to horses.
I've been called worse.
Now that you brought up a horse, this is the next controversy in the state of Mississippi is taking the horse medicine. What is long term? I hear that really long term effects could affect your kidneys. Is that true? What is the real truth of it, John?
From what I've been told through the physician experts that I've talked to in the medical community, one of the devastating side effects is liver damage, and so the use of ivermectin, obviously, is the drug that you're talking about, which is used in cattle and horses, and actually I think is also used in heartworm treatment for dogs, is not prescribed for the treatment of COVID-19, even a preventive. And that's one of the things that I think is happening amongst certain folks is they're taking it as a prophylactically to try to prevent themselves from getting the virus.
What do you say to that person that says, well, they're just trying to make more money through medicine to make me take it that way? I can buy this same product right here. It's cheaper through the veterinary side than it is if I go to the pharmacy. What do you say to that person?
Well, first of all, I'm not going to encourage them to go to the pharmacy or the livestock, or to the co-op or any other place that sells ivermectin. I guess my response to that is you need to talk to your physician. Again, the expert is going to be the doctor, but you just need to stay away from that home remedy. And I think that it's unfortunate though, Scotty Ray, is that there's a lot of information coming out in social media that is really wrong, and it's damaging and it's hurting people. And I just, you got to get away from that, and get to your physician and talk to them and let them guide you on treatment plan and vaccine, and all of the things associated with this.
John, Anderson's is now giving the inversion. What's the
infusion?
Infusion.
Yes.
The inversion. They turn you upside down and shake it out of you.
Oh, one of the greatest things that's come out.
That's been real helpful, hasn't it?
We've given close to 1,000 doses of the monoclonal antibodies.
Tell us the procedure there. They test positive, then they come to the clinic.
Yes,
what does a patient do?
Okay, so if you test positive, the first thing you do is you can reach out to your physician, or if he tests positive, your physician knows that they've got a course of treatment that's monoclonal antibody. We're giving it at our South Campus facility at the hospital at South Campus. We converted the old emergency department there to an infusion center. Now we're able to give it subcutaneously as well. So that's a series of injections rather than through an IV. The requirements to actually receive the monoclonal antibodies have been relaxed considerably over the past several months because it's proven to be so effective in the treatment of the disease, in so much that our experience here has been less than 0.5% of the people that we've treated have been hospitalized. So they're getting well at home. They still have signs and symptoms, but they're not as robust. They're not as strong. They don't end up in the hospital, and they're able to get well at home.
That's helpful across the board.
Right. And also, we're actually accepting home test kits results. So if you test positive at home, you can call and set up an appointment. And that's what we do. You have to have an appointment, though. You have to be able to come in because you're considered COVID positive, right? So we have to take care of all of the protections with the staff and with you and other patients. But it takes about the length of time to get to receive the medication, depending on what you get. If you get an injection, it's probably a 30-minute time frame there, maybe less. Then you have to be watched for an hour.
Okay.
If you get the infusion,
bring a book.
Yeah, exactly. And then you go home. But it has been a remarkable finding and a remarkable drug, and to take care of the COVID patient. The thing is, though, you got to get it as soon as you can. There's a 10-day window that you can receive monoclonal antibody. But if you can get that as soon as you test, within 48 hours, 72 hours, that's when it's so much more effective for the patient. And we've been able to, one of the things that has happened within the last week for us is we've been able to receive some additional help from the state, and we've got additional help in our infusion center now with more manpower. So we've expanded our hours and moved into weekend as well. so that we can take on more patients in that location and serve that patient population better, and get that monoclonal antibody into their body so that they can start feeling better very, very soon. And usually that's almost within a 24-hour window.
So the lesson plan sort of is, say Scotty Ray gets exposed to someone who has the virus,
right?
Then he needs to go immediately and get tested. You're suggesting that. We've heard to wait 5 days.
Yeah, I've heard that too.
But don't wait 5 days. You're saying
I would suggest that you go and get tested. And with respect to monoclonal antibodies, what has happened now as far as we're being able to take those patients on, if there's a contact associated with this, so if we're sitting here and I'm COVID positive and you guys have been around me for a significant period of time, you've had an exposure. You also have an opportunity to get treated just because of that contact tracing and that exposure. Before, it was strictly test positive, and then there were certain criteria. You had to be immunocompromised, over a certain age, all of those other things. But that's been relaxed because this is working so well. But it's not, let me say this, it's not the panacea. It's for people who get sick, right?
Yeah.
It's not to prevent you from getting it.
Right.
What's going to help prevent you from getting it is getting a vaccine.
Okay, so now people may be wondering, I'm going to stay home. I can't afford this. Is there a charge?
No.
Okay, that's what you need to.
That's good.
That's important to know.
No.
And there's not an age limit on it.
There is an age limit, but we have been doing some, and I'm sorry, I don't know what the age limit is.
Okay, but there is, and they can call
there is an
in.
age limit, but that's one thing you can do is check to find out if you have a kid who is positive, they may qualify for the antibodies. We have done some pediatric patients. I know that. We have treated several kids. I just don't know their ages.
Don't know their ages, but
I would suggest they're probably going to be above 12, most likely.
all right. And I
But
have
just
another
don't know
question.
that.
Well, I hear this around the coffee pots. When you go into a store, this is the next thing. And this is just to clarify for a few folks. I don't think they understand that, the vaccines come out and they've had to tweak it a little bit. And the word booster shot comes up where they go, well, they don't know what they're doing. It's not working. That's why they're having to do this, and we don't know what's in that new stuff. How do you convince someone to realize that the scientists realize that this disease is changing, and so they're tweaking to stay ahead of it? What do you say? Because I think, and correct me if I'm wrong, there's a new one that is starting coming from South America, another version of this headed our way, isn't it?
Isn't it Lambda?
That's right.
Yeah.
And this shot may not affect that one, so we may have to get something to fight that off. Am I right or am I wrong on that?
I can't speak directly to that, Scotty Ray, but I can tell you what I think that we're looking at here, and this is what I'm being told too, is unfortunately, this is a virus. Viruses mutate. The flu is a virus. We get a flu vaccine opportunity every year. There are strains of flu. They develop the flu vaccine based on the most prominent strain of the time. It doesn't keep you from getting the flu, but it lessens the effect of getting it if you get the flu, right? And you can have a flu vaccine that's type A flu, and you can take that vaccine and it may prevent you from getting type A flu, but another strain of flu can mutate and come out, and you may catch that strain. It lessens the impact of the flu on you. The COVID-19 virus is a virus. That's why we see a variant. That's why we see the Delta variant. We went from the Alpha to the Delta, now the Lambda's out there. The vaccines that are being developed, including the booster, are to be able to help prevent you from getting the disease. And if you do get it, you have the less effect of the disease on your body. The booster is just something else to help rev up your immune system. Now, if the Lambda variant comes, because the current vaccines that are out there now are helping people, if they get the Delta variant, are helping them from being hospitalized. And the same could be said with the Lambda variant or the Gamma variant or whatever else comes out. Well, these scientists are constantly working to develop vaccine to help boost your immune response to keep you from getting critically sick and hospitalized, be able to get well quicker. I think that the booster is, when it comes out, it's out now for people who are immunocompromised, like folks who have had transplants, things like that. The second option is going to be probably coming out in September, where those of us who have had the vaccine 8 months later can take a booster just to keep us, our immune systems, being able to respond to the virus if we're exposed to it. But I don't think there's any question that the boosters are going to be very important for folks to take.
What if you've had the Moderna shot and the booster comes out? It's the Fauci booster, Pfizer booster. Do you take the Pfizer booster if you've had only the Moderna? Do they mix them?
I'm not sure that I'm qualified to answer that question.
But it's a viable question.
It is.
There's just so much.
I think, again, you go back to your physician and you talk to them about it. Both the Moderna vaccine and the Pfizer vaccine are messenger RNA vaccines.
Right.
But I can't answer, whether they're
You're not a doctor, is what you're saying.
Right.
Yeah,
and I can't answer the interchangeability of the two. I do know that if you take the Moderna, the first dose, you need to take the Moderna, the second dose.
All right.
As far as the booster goes, I don't know whether you interchange it or not.
Because there's been a lot of people that said, well, I went and signed up because I don't know if misinformation is the word, but the J&J shot, that was there a lot of that put in Meridian? And if you had that, is it okay to take a booster from a different one, or is there something specific you have to stay with the J&J?
Yeah, that's what I was asking.
The J&J is a single dose vaccine.
Right.
Its makeup is different than the Moderna and the Pfizer vaccines. So even though the J&J is an effective vaccine, it doesn't have the coverage effectiveness that the Moderna and the Pfizer have.
Could you back up and go, whoa, wait a minute, let me go get that Moderna one instead and mix the two in your body?
And Scotty Ray, again, I think the best answer for that for me is to reach out to your doctor and talk to them about what you've had. If I took the J&J, what's my option next? If I want to take the booster, or what do I do next? And let them give you guidance on that, because I'm just not qualified to do that, and I don't want to steer someone in the wrong direction.
And we had someone ask this question that just popped up on there. It says, which is more effective? And you may have the same answer to that of which is better, Moderna or Pfizer? Or is it just a preference?
Yeah, I think it's more of a preference. I think what some of the science has shown that Moderna probably has a little better coverage, if you will, for contracting the variant versus the Pfizer, but both of them are incredibly effective. I took Moderna because it was first available for us.
I think a lot of people did that. They simply got in the line and they didn't question.
I don't think, if Pfizer had been first available for us, I would have taken it. So I think the most important thing to do is get the vaccine.
What has hurt this so much is in the very beginning when this came out, if you'll remember, Trump got it. He went in the hospital, he stayed about 5 days, and he was given a mixture of medications and came out fine, and he's in his late 70s. I'm not speaking against the vaccine, but I'm speaking to why the credibility of it is so tenuous and so questioned, because he was given ivermectin. No, I beg your pardon, he wasn't wormed. He was given, his worms were fine. Hydroxychloroquine and some of those other, there was a casserole. That was working. Hydroxychloroquine was working. Then suddenly Fauci came out, shut down big farms about it. We knew that was working. That's one reason I think a lot of people are going, I'm not buying what they're selling. And that was the government interfering. And I'm not disputing anything you're saying, because I have all trust in Anderson Hospital and John Anderson. But we have to look at the whole, the dichotomy of it, is why people are being so. And then And then people are dividing up over opinions.
Oh, there's a lot of opinions out there on that. And I guess, again, that would go back to talk to your doctor and let him help you decide that. And it is probably on all levels. I don't think anybody trusts the government like we used to. It is there's a divisive
They've done
line.
this to themselves, in other words, not the medical community. And the medical community, unfortunately, is paying for it. So are the people.
Yeah, because, I mean, by all means, John, you want everybody to be as well as they absolutely can
And y'all
be.
offer them help and hope.
There's an unintended consequence to this situation, and that's the fact that when it's first started, the pandemic first started, we were forced to just shut everything down and solely concentrate on taking care of that patient population. And we frightened people away from the hospitals.
You did, yeah.
Not just here, but everywhere. And folks sat at home with chest pain. They sat at home with, I'm losing feeling in my arm, and did not come to the hospitals because they were scared they were going to catch COVID, which is unfortunately a fault of our own. And that's the last thing that needs to happen right now. People need to use their physicians. They need to use their hospitals to seek care. We will take care of you. That's not without question. We will take care of you. If you're in a situation where you feel sick, whether you're having symptoms, whatever it is, you either go to your doctor or you call 911 and you head to an emergency room.
Let me ask this, and I know that you're in meetings throughout the day with the people that are on the front lines. I know that you run the hospital and you do various things, but I'm sure at some point you had conversations with people who are down there who care for these people that come in that are sick, and then it gets worse and worse. What do you say to the person that goes, I'm not going to get this. I'm going to take my chances. And you've been around that person that's willing, that's clinging for life, that is hurting, that can't breathe, and I had that tube thing down my throat when I had my heart surgery. That is not good. It does not feel good. What do you say to convince somebody to come around to try to save their life? What is the words that you would put out there?
Well, gosh, we don't have enough time. I wish I had been smart enough, or had the acumen to keep a diary of the events of the past now 20 months. I've seen my staff just wither at times, where they have a patient who is a COVID patient that's on a ventilator, and there's nothing that can be done. And they're the only person, they're the surrogate family member who's in there. And they watch the demise of that patient throughout time. The current situation is such that can be prevented. Back before, we didn't have the tools in the toolkit to prevent something like that. But now we do. And that tool, that major tool, which is a pretty large hammer, is a vaccine. Because back to what I said earlier, 90+% of the patients that we're seeing that are COVID positive are unvaccinated. 86% of the deaths that are coming out are the unvaccinated population. If you take the vaccine, your risk is a lot less. And that's just, to me, that's the linchpin to this whole thing, is getting as many vaccines in arms as we possibly can. We're 50th in the country in vaccines statewide. We've had 37% of our population vaccinated. The county is mirroring the same thing as the state. We're about 37%. Now, I will say this, that's 2% higher than it was a month ago.
Right.
And so maybe the trajectory is right now. But that's so important, because if you think about it, 37% of the state is vaccinated, but 63% is not.
All right, let me ask this. I know originally when we spoke that you had a time limit you needed to go.
Sure.
Do you need to step on out and go to your next appointment?
Yeah, I'm gonna have to cut out in just a minute.
Okay, well, we want to say thank you for coming by and talking with us about this, because there is so much uncertainty. And one last question is, I had somebody pop up and say, where can I get I've had the vaccine, where do I get the booster shot? Do you know where to go to, who to call, or just call the main line at the hospital?
You can, if it depends on where you received your vaccine in the first place, you might reach out to whomever where you received the vaccine. If you got your initial dose at a certain location, you need to reach out and find out where your booster shot can come from. But more importantly, right now, you've got to have a physician's order for that booster, because the booster is strictly right now, it's strictly for people who meet certain medical criteria. So they've got to have some sort of chronic disease issue that allows them to receive the booster, and that's got to be a physician's order. So if you've got a doctor, your primary care provider, whomever that might be, reach out to that physician, talk to them about getting that booster, and they can schedule you a vaccine at a number of locations throughout this city.
All right, I have another question regarding that, and then I will let you go, or I'll write you a note if you're late. But once you get this vaccine, does that go in your medical records?
Yes, I believe it does. I believe
Then wouldn't that medical record be protected by HIPAA?
It should. Yes.
Then why can someone that's owning a restaurant demand to know if I've gotten
Good
that?
point.
It's an emergency use authorization and a public health emergency right now.
In a
mandated
restaurant?
by the federal government.
So that's the government overriding our
I think that's
HIPAA.
correct, Sidney, but I don't want to speak out of turn.
That's a disturbing fact to me.
Yeah, and that is a big question across America.
Because
about
no
this.
one has a right without my giving them permission to look at my medical record. Is that not right?
You should have been issued a vaccination card.
And it would still
That's
be my
part of your-
choice whether to
right.
show the card or not.
I guess that's
yeah,
a very
just
good
like
question.
okay,
Yeah.
okay.
And I will tell you, the politicalization of this disease has been probably
Astounding.
has been to the detriment of the public health system.
Yeah.
Absolutely.
And with that same thing in thought, there's a lot of people that lose that little card. So you could, if they're keeping track of it, you could contact the person where you got it done,
Right.
and they could reissue a card if you
Right.
needed it.
Yes.
Because it's just a little piece of paper that.
Well, it is, but if it's in your medical records, you could go to medical records and ask for them to give it to you.
I don't
guess.
know. I don't know if it would be in the medical record unless you presented it to the hospital that you are in the clinic. That
Well, if you got it
came
there, it
from.
would be.
It might be there.
There's a lot of wrinkles in this.
I was vaccinated through our employee health program.
So you have it
at
on
the
record.
hospital.
Sure.
I have my card.
Yeah.
But I don't think I'm a part of a medical record at the hospital.
Okay.
I have my card.
Yeah. Okay.
We appreciate you coming in. We can't thank you enough. And I know that you're busy, and we're probably going to invite you back again because there's tons and tons more questions that we can ask later. But thank you so
Thank
much.
you so much,
You're quite
John.
welcome. Thank you for having
And that's
me. Y'all
CEO
have
of
a great
Anderson
day.
Hospital.
It is. Thank you.
Thank you,
Again, John, so nice of him to come in this morning and visit with us to talk about all of
It's
this.
a trooper.
He is. And I know that there's a lot more questions that everybody has, and we will revisit. Thank you. We're going to have some more guests about this because we hadn't answered everything. Boy, I've sitting here reading everything that people are posting, wanting to know. One of the questions was, and I don't know the answer to this, is if you smoked, is this worse on you? That's another question that we want to ask.
Are you already in trouble?
Yeah.
You mean if it was the vaccine be worse
well, no,
on
they're
you?
saying if you're a smoker, is COVID worse on your body because you're a smoker? Because, it has so much to do with your respiratory.
Yeah. And then I've heard if you get it, don't lie down, stay seated or.
So I didn't know that.
Yeah, but
I hadn't been paying attention.
you got to go into the deep things to find these things out.
Somebody said we look like a big Halloween.
We do. We dressed alike.
We is. Let's take a minute and talk about Chet's Paint and Body. If you have not visited my friend Chet, go by and see him. If you have a fender bender, and this will happen to you at some point. I remember about, 8-9 years ago, I got a call from Dylan Ray. He goes, I got an issue. He got hit by a school bus and run off the road and knocked down like 5 mailboxes. Chet came to the rescue. Nobody was hurt. It was okay, but the truck had the bus on one side and mailboxes on the other side. And I'm telling you, when Chet got done with it, it was like it had never been touched. It was beautiful. He done a great job. And he can do this for you. This is a truck that they're redoing here. They had a few dings. This is one that caught the door. You leave your door open and you back up and it slaps up against your fender. They fixed it. It looks as good as new. We look at a car that's been backed into or run into the bumper of a car. Well, you got that. These are those aluminum beds I've talked about. They can fix that back to the way it was before it come from the factory. Probably even better than they did because it was a Friday when they built the truck. They want to go home.
4 o'clock.
GMCs, they can fix them as well. No matter what the make or model, this is their paint booth. If you've got a classic car, he can do those. It's all at Chet's Paint and Body. See him. Insurance claims are welcome. They'll work out if you need to get a rental car. They'll call them, fix all that for you. See Chet before you do anything to your car to make sure it's
negotiating with insurance for
he
you.
Does.
He takes that nightmare off of you.
And it is a nightmare.
It can be.
So they'll make it simple for you. See him today at Chet's Paint and Body.
I was coming down Highway 19 on a bicycle. I got hit by a car. When I woke up, I was in the hospital. I called Mr. Schwartz. He took my case. He was there for me from the beginning to the end. 5-6 months later, I had my settlement.
One call, that's all.
And welcome back with Scotty Ray and Sidney. And somebody made a good point there that I didn't know that, the record being on file with the health department.
Mm-hmm. Because they got theirs done in a drive-through by the National Guard.
Yeah, my mom done that.
Yeah,
I drove her through.
did. Yeah.
And boy, was that, I got to give them credit. They worked hard, and that was an assembly line. It worked fast. You didn't sit there all day.
Mm-hmm. You just waited about a little bit afterwards to have
15 minutes on the side of the road there. And then they kept a clock, and they would move you out. And it was simple. Now, for the folks who've never had it, you get your first shot. Your arm does hurt that first day. First few hours it doesn't. A few hours later, it has a little burn. Nothing big. The second shot, my wife, she never slacked up. She kept going. But me, I felt a little tired.
It's because you're a boy.
Yeah, that's what it was. I'm a weenie, I think is the word. And so I moped around that second shot for about a day there. And then
what you did.
Oh, I did. I didn't want to do nothing, no way. But those are some of the side effects, but I'd much rather have that than be laying in a hospital with a tube. No, this is not for everybody. And again, as John stressed this, talk to a doctor. It's important.
Talk to more than one. In fact, one thing a lot of people are doing, now I'm not a doctor and I never played one on TV, but a lot of people.
Are you sure?
Yeah, pretty sure. I've gotten old and I've forgotten a lot. People are taking vitamin C, zinc, vitamin D, and there's another one they've added to it, quercetin or something like that. But if you get those 3 for sure, that's a real good firewall just to make you healthy.
That's called the cocktail, isn't it? Is that what everybody's calling that?
I guess it is, but because I'm on hydroxychloroquine every day anyway for another issue, but and I'll sell it to you for $125. I won't either. But anyway, so every morning I pop those 3 pills in Cuz and send him on off to work. Cuz is my husband, if anybody wants to know.
You have to take care of him.
Yeah.
I was looking through things that are going on because I like to recap things that are going on. Today's birthday, you remember this guy right here? Sean Connery?
Yeah. Shaken, not stirred.
That's him. He was born in 1930 on this date. Now, if I'm not mistaken, Sean passed away not long ago, if I'm not mistaken.
From COVID?
I'm not sure. Was it? It could have been.
No, I don't think so. I think he.
But Sean, boy, he was a great actor. I really liked him.
Handsome man.
Let's see here. Who else had a birthday today? That is, here we go. The Wizard of Oz opened in 1939.
Oh, wow.
Did you go to the opening ceremony?
I was sick that day.
You couldn't make it, huh?
Couldn't make it.
But boy, what a classic that is. And when you and I were kids, being honest about it, you got it that one time a year. And if you didn't catch it, you missed out. Same as Charlie Brown.
Me. Those flying monkeys got me every time.
Somebody told me that the monkeys also scared them to death.
Yeah.
Have those nightmares?
Do you know what the guys are saying? Oh, yeah.
Yeah.
You know what they're saying?
No.
A lot of people think they're talking about Oreos, but it's, we are the old ones.
Really?
Mm-hmm. If
Didn't
you
know
play
that.
Trivial Pursuit,
I would have known that, wouldn't I?
Yeah. I mean, Gene Simmons.
Yeah, he's a different kind of man.
Well, I'd say so.
Born back in 49. Do you remember, did you see that last interview that he got at Fox News? He can't go back anymore.
No.
They interviewed him, and he took it upon himself that he should just go start going in offices, and he busted up in a board meeting that they were having, and he is no longer invited back to Fox News.
Rude. They should let him come back. He was a guest.
He is concerned nothing but about money. Have you ever listened to him? No. It's how much can I make off of this?
That's tacky.
He's very tacky. Also, I know you know this song. Y'all remember the Locomotion?
Do 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 do.
62. It was the number one
That's
song
not
across
Locomotion,
America.
Whatever I was singing.
Everybody's doing a brand new dance.
Everybody's
now.
doing a brand new dance now. The Locomotion. Yeah, I think that's it.
Yeah, that's it. So that was number one back in 62.
Okay. And
Do you remember this one?
Shoot, yeah.
It was the 3rd of June, another hot and dusty Delta day.
Yeah.
Number one on this day. And she, she just kind of disappeared
She
from
was
the
a one-hit
limelight.
wonder.
It was. 1970, Jo Dee Messina was born. Y'all remember her?
Oh, yeah.
Heads, Carolina. I like that song also. Heart to Heart. I love this show. Do you remember it? I'm not sure if it was the dog that I liked the most or if it was Stephanie Powers that I watched.
And they were really married, weren't they?
I don't know.
No, they weren't. Whatever they were, you would have thought they were.
Yeah, they were.
Yeah.
And his first
Yeah.
wife, of
but
course.
She was a real pretty thing.
Yeah,
His
she-
first wife was Natalie.
Natalie, and that's still
Yeah.
under investigation.
Yeah.
Not a lot of people want to marry him after that.
No, unless they can swim.
But that's true. But that show really was good. I enjoyed it.
Oh, yeah. It was a good one.
One of those back in the day. And your heartthrob,
Yeah, he's kind of cute.
Billy Ray. And, of course, he made the mullet famous.
Okay.
Did you like the mullet? Be honest with me.
No.
I remember the first time I heard that song, and I was like, that's different. But golly, it really hit. And
What was the song?
Achy Breaky Heart.
Oh, yeah, I like that. And I like the way his little blue jean, whatever.
Yeah. And then, of course, Some Gave All became really probably one of his more favorite songs
yeah.
about veterans that people
That was the
just.
time of life for us.
Yes. Ted Kennedy, who remembers Chappaquiddick?
There's a nasty boy right there. Right there is nasty boy. Another one that helped somebody swim with fishes.
He did. 2009, he passed away. And I don't know if you ever really read all that about Chappaquiddick.
Oh, yeah.
He left her, and for 20 minutes, she was probably at least maybe 2 hours, was it?
Mary Jo Kopechne.
Awful way to go.
Left her in the car.
And it sunk
Yeah.
slowly.
And he went back, and his daddy covered up everything. Yeah. Yeah,
That's
he was
exactly.
guilty, but I bet he's paying for it now.
Yeah, he's at that place where they take care of things like that.
No, it's warm.
That was miserable. And that just goes to show how money can cover
yeah.
things up.
Yeah.
Y'all know that as well as
On
I
Earth.
do. Mm-hmm. It doesn't elsewhere. Also, Neil Armstrong passed away on this day. One giant step for, how did it go for mankind?
Let's see. One giant step for mankind, one small step for man. Or something.
Did he actually really say that rumor out there? No. The other thing where he said hello to some woman, hello, Mrs. Whatever. Did he really say that? Or was
No, that was Jimmy Durante.
Okay.
What was her name? I've forgotten, but no, that one.
You know what I'm talking about.
I do.
John McCain also passed away on this date. Probably not a Trump voter, I'm going to say. I'm just thinking that out
That
loud.
was a shame. That got dirty.
Oh, that was.
And his little girl didn't take it very well.
Now, she got feisty over it, didn't she?
Yeah, she went all 8th grade ugly girl on that.
8th grade ugly. I hadn't heard that said before.
Well, mamas know what I'm talking about.
Oh, that does happen, doesn't it? Well, she was upset over it, to say the least there.
Yeah.
Boy, this is we're going to talk a minute about what's brewing out in the Gulf. Come Sunday, Monday, we may be having a different story. There's some stuff building out there that could possibly come into the Gulf. 70% chance of this thing building now. And we're going to show you the maps here in just a moment so that you're up to par on all this stuff of what's going on. We don't want nothing sneaking up on you. Right now, we're going to go and talk about Maple's One Stop Shop. Now, they've got convenience stores that are locally owned and operated right here in the Meridian area, right there in Broadmoor. You can't miss it. This is a Chevron station. Drop in. If you fill up with gas, they're giving away a weekly card that gives away $50 in fuel. Write your name on the back of it and drop it in at the cashier, and you're in for the drawing.
That's not bad. What is his truck draw? What's that?
That's a little smoke back there, a little putt-putt.
Oh, okay. Looks like he was dragging the gas thing.
Left it, the hose.
I did that one time.
Ooh, I bet that was bad.
I thought I was really cool in my car, and I just sort of got in my car
Everybody's
and I was
waving at
driving
you.
off. Then I heard, I looked back and
Oops. Always check that while you're at the pump.
I do now.
They can help you out whether you're looking for a cup of coffee, if you're needing a cold drink, whether it's the fountain drink
It's a
that you
clean
prefer.
place, y'all.
It
It's
is.
a clean place.
And of course, if you're looking for that, if you want, like me, who spills everything and you need a cap on it because you slam on brakes and you spill everything, they got those drinks for you also.
And you can also get your Pfizer shot. No, I made that up.
You can get yourself some pizza along with a bag of chips and a fountain drink, all for $4.99. If you're looking for a great lunch, you can get that at the Chevron in Bonita or Pine Springs. Plus, if you're going fishing, the bait shop there at the country store, you can get lotto tickets, ice cream, you name it. And of course, they've got several locations, the Bonita Chevron, Pine Springs, or you can drop by the Last Chance Tobacco or Broadmoor Chevron. See them today. That's Maples Gas.
It happened so fast. I didn't even see that person behind me. I said, well, I need to call Richard Schwartz. Once I made that one call, they began working for me. They are going to make sure you get what you deserve.
One call, that's all.
There we go. It's one small step for man, one giant leap for mankind. Way to go, Gail Williams.
I knew part of it.
I knew it was about walking in the dirt.
And Debbie used to pick on me a lot about that, of how I could take one saying and part of another one and I combine them, and I would really think that I was right.
Okay.
It's just a flaw I've got. I can't help it sometimes. So as we were talking earlier, now you're involved in several plays that are coming up. Just wrapped up.
Yeah.
It was sold out, wasn't it?
Yeah, we had 3 nights and it was sold out. And if you weren't there, I'm not going to talk a whole lot about it, but you missed one. But everybody's already asking for us to do another murder mystery dinner at the Meridian Little Theater, and so plans are underway. Our theater is alive and well.
How many people will it seat? How many people can come in and watch?
You mean the play?
Yeah, inside. Because I told you the other day, I've never been in.
Tour. Oh, you need to come have a tour. I think we can seat 387. I may have made that up, but it sounds really good. But we're going to open Guys and Dolls. Now, I want to tell you something, people.
Tell me.
That is a classic. We're trying to bring back the classics because a lot of the new stuff that you see on Broadway
is boring.
It ain't fit for human consumption. I'm hearing you. It is dirty, nasty, ugly.
And we don't want
Even
that.
though it's got good music in it. But, we just don't do that down here. So we're going back to the classics. We did Oliver and Sound of Music. But this time we're doing Guys and Dolls. We'll be opening with that.
When's that coming?
That opens October, the first week of October, I think. But memberships are on sale now. If you buy a membership to the Meridian Little Theater, you get 4 quality plays. One of those plays actually only costs $4.
Really?
With the membership. Mm-hmm.
Now, what if you're not a member and you just want to go one particular show? Can you buy one of those?
Oh, yeah. The tickets cost a little more.
Okay.
But we've shortened our nights of production. So we open on a Thursday, then we have Friday, Saturday, and a Sunday matinee, and then we close. But I'll come back and talk to y'all more about that. But right now, membership tickets are available to the Meridian Little Theater. And really, I don't think you'd have the Riley Center or the Max or any of that if it hadn't been for the Meridian Little Theater.
Y'all have been there.
89 years. This is our 89th
You're kidding.
season. Yeah.
Now, the new building, when was that built?
In the early 60s.
Okay, I was going to say I was around, but 70s? I'm not.
I don't know. I started in 63. At the one on North Hill Street, which is where the fire station is now. It was
I didn't know that.
Schoolhouse. Yeah. And it burned down. And then we went to the Temple Theater where they built the new facility. So right around the late 60s, we got into that new facility, which is not so new anymore. We had to place the roof and patch the, you know how it is. But anyway.
But it's there on Highway 39. I've passed by it so many times, and you see it, and you go, well, one day I'm going to, and I brought that up to you that I do want to do that.
And we'll give you a tour. And listen, we even have a portion of it now that's got a ballroom, the Linda Davidson room, and a gorgeous patio and a full kitchen, and people rent that facility now, and it's the best rental in town. It's on one level, and you got a kitchen, and so if you're having a bridal shower or a baby shower, or you want to rent for the weekends or whatever, we have a sliding scale, and we've got those gorgeous new chairs that people are having to rent from other people. I know you don't know about chairs, but
I don't know
either. Chairs or something, I don't know, but they're really fancy little chairs. They're not your old autumn, fold out chairs anymore. So we're kind of a class act. We got toilet paper on all the rolls. And
that's important.
The bathrooms are inside. And
that's even better.
We feel real good about it. So you do want to check out your Meridian Little Theater. It's a great Christmas present to give somebody a membership.
Right.
And it's very affordable. It's the best ticket in town.
Well, there you go.
Yeah.
As quickly as I'll tell you this is what we're watching here. Okay. This could happen next week. As you'll see here, these spaghetti models coming up from the Gulf down here. This is where this thing is sitting, developing now. It's a 70% chance that this is going to turn into something. This is early. We're going to watch this, but if you'll see here, Mississippi is being chosen, a little bit there on Alabama. It's early. We don't know where it will go, but we're watching it very carefully.
Between Louisiana and Alabama may get hit.
That's possible. It's called a landmass, I think.
Landmass.
Yeah, I'm glad we
between
remembered that.
Louisiana and Alabama. That's right.
Don't forget, this afternoon they're going to be giving away a mask and also hand sanitizer at Fire Station Number 1 that will begin at 3 o'clock. So if you're needing some of that, drop by there and they'll
Well,
hook
there
you
you
up.
go. Will they also sweep out your car?
We need to ask.
Well, you know, all
Chris
the meals
Reed has
that
been
you
doing a lot of that lately, trying to make ends meet washing cars.
Bless his heart. He's still the chief. I'm here to tell y'all, he's still the chief.
He is. Everybody likes him.
Yeah.
Great guy.
Yeah.
And I want to say thank you for coming in this morning and filling in.
My
Thanks
joy,
a lot.
My joy. And my thoughts have been with Candace, and I know you look forward to having her back tomorrow. I hope that she dresses to coordinate you. Like
And she better call me. Yeah. Thank y'all for coming by and being a part of this. We can't do it without you, and every day. Thank y'all so much. And I'll be back tomorrow morning. Thank you, Sydney.
Thank you.
Scotty Ray's Weather is brought to you by